Stress can have a surprising and significant impact on diabetes, often making symptoms worse and harder to manage. For women, the relationship between stress and diabetes is particularly challenging due to hormonal fluctuations and lifestyle factors. If you've noticed that your blood sugar seems harder to control during tough times, you're not alone. Stress can affect your blood sugar in ways that may surprise you. In this guide, we'll explore how stress impacts diabetes and share actionable steps you can take to regain control and improve your overall well-being. When you're stressed, your body activates its fight-or-flight response, which is designed to help you deal with immediate danger. During this response, stress hormones like cortisol and adrenaline are released, signaling the liver to release stored glucose into the bloodstream to provide energy. While this is useful in emergencies, it can lead to complications for women with diabetes. High cortisol levels make it harder for insulin to work effectively, which can result in blood sugar spikes. Over time, chronic stress keeps cortisol levels elevated, making blood sugar regulation even more difficult. This can contribute to long-term complications such as nerve damage, kidney disease, and heart problems. How to manage stress-related spikes. Identify triggers. Pinpoint the situations or events that cause stress. Practice relaxation techniques. Deep breathing, journaling, or meditation can help lower stress levels. Monitor blood sugar. Keep a close eye on your blood sugar levels during stressful periods. Maintain a healthy diet. Focus on meals that include whole grains, lean proteins, and non-starchy vegetables to stabilize blood sugar. Stress often triggers emotional eating, where comfort foods become an escape. These foods, often high in sugar, fat, and refined carbohydrates, can cause rapid blood sugar spikes. For women, this pattern is exacerbated by hormonal fluctuations, which can heighten cravings during stressful times. The issue isn't just about overeating, but the vicious cycle it creates. Stress drives emotional eating, which worsens blood sugar control. This, in turn, leads to guilt and frustration, amplifying stress even further. How to break the cycle. Plan healthy snacks. Replace sugary treats with options like nuts, Greek yogurt, or fresh fruit. Practice mindful eating. Slow down and focus on your meals to avoid overeating. Keep a food journal. Track what you eat and how you feel to identify patterns and triggers. Build a support system. Reach out to friends, family, or a therapist for emotional support. Stress doesn't just impact your emotions, it can also interfere with your sleep. Elevated cortisol levels disrupt your body's ability to produce melatonin, the hormone responsible for regulating sleep cycles. Poor sleep, in turn, keeps cortisol levels high, creating a vicious cycle of stress and elevated blood sugar. For women with diabetes, this can be especially problematic. Sleep deprivation can worsen diabetes symptoms like fatigue, irritability, and frequent urination. It also disrupts hunger-regulating hormones, leading to increased cravings for sugary, high-carb foods that further destabilize blood sugar. Tips for better sleep. Establish a routine. Go to bed and wake up at the same time every day. Limit caffeine and screen time. Avoid these in the evening to help your body wind down. Practice relaxation before bed. Try yoga, meditation, or a warm bath to reduce stress. Create a sleep-friendly environment. Keep your bedroom dark, cool, and quiet. Women face unique hormonal challenges that can make stress more impactful. Menstrual cycles, pregnancy, and menopause all bring fluctuations in hormones like estrogen and progesterone, which can affect how the body regulates blood sugar. Add stress into the mix, and the effects can become even more pronounced. For example, during menopause, declining estrogen levels can exacerbate stress-related blood sugar spikes. Similarly, premenstrual syndrome, or PMS, can lead to cravings, fatigue, and mood swings, all of which make blood sugar harder to manage. How to adapt. Track your cycle. Use an app or journal to identify patterns in your blood sugar and stress levels. Adjust your diet. Focus on whole foods, especially those rich in fiber and protein, to stabilize blood sugar. Incorporate stress relief activities. Yoga, meditation, or gentle exercise can help balance hormones and reduce stress. Talk to your doctor. Consider discussing hormone therapy or other options to manage symptoms. Stress can worsen insulin resistance, a condition where the body's cells don't respond properly to insulin. Elevated cortisol levels interfere with insulin's ability to help cells absorb glucose, leading to higher blood sugar levels. For women, this effect is often compounded by hormonal fluctuations. Prolonged stress can also lead to weight gain, particularly around the abdomen, which further increases insulin resistance. This creates a cycle where stress and poor blood sugar control reinforce each other. How to improve insulin sensitivity? Exercise regularly. Engage in moderate activity like walking, swimming, or cycling for at least 30 minutes most days. Focus on balanced meals, incorporate lean proteins, healthy fats, and fiber-rich vegetables to stabilize blood sugar. Limit processed foods. Avoid sugary snacks and beverages that contribute to blood sugar spikes. Chronic stress suppresses the immune system, making women with diabetes more susceptible to infections like urinary tract infections, yeast infections, and slow-healing wounds. High blood sugar creates an environment where bacteria and fungi thrive, compounding the risk. Stress also slows down recovery from illnesses, leaving your body more vulnerable to complications. How to strengthen your immune system. Eat nutrient-rich foods. Include foods high in vitamin C, like citrus fruits and strawberries, E, such as almonds and sunflower seeds, and zinc, like pumpkin seeds and cashews. Stay hydrated. Drinking enough water supports overall immune function. Practice good hygiene. Regularly inspect your skin for cuts or infections and treat them promptly. Stress doesn't just affect your physical health, it also takes a toll on your mental well-being. Women with diabetes are more likely to experience anxiety and depression, which can make managing the condition even harder. Chronic stress disrupts brain chemicals like serotonin and dopamine, leading to mood swings, fatigue, and poor focus. Mental health challenges can result in skipped medications, unhealthy eating, and less frequent blood sugar monitoring, worsening diabetes symptoms. How to support your mental health. Eat mood-boosting foods. Include omega-3 rich fish, dark chocolate in moderation, and leafy greens in your diet. Engage in physical activity. Exercise reduces cortisol and boosts serotonin. Practice mindfulness. Techniques like meditation and deep breathing can help reduce anxiety. Seek support. Build a network of friends, family, or a counselor to share your challenges. Stress can cause physical symptoms like fatigue, headaches, muscle tension, and digestive issues, which may mimic or worsen diabetes symptoms. Elevated cortisol disrupts glucose regulation, leading to spikes or drops in blood sugar that resemble diabetes-related fatigue or dizziness. Stress can also affect digestion, potentially slowing or speeding up glucose absorption and interfering with insulin's effectiveness. How to manage physical symptoms. Identify triggers. Pay attention to the situations that cause stress-related symptoms. Adopt anti-inflammatory foods. Include fatty fish, berries, nuts, and whole grains in your meals. Avoid sugary snacks. These can worsen blood sugar fluctuations and inflammation. Engage in relaxation exercises. Yoga, Tai Chi, or light stretching can relieve muscle tension and lower cortisol. Stress is an unavoidable part of life, but its impact on diabetes doesn't have to be. By understanding how stress affects your blood sugar and adopting strategies to manage it, you can break the cycle and improve your overall health. From prioritizing sleep and exercise to adopting a balanced diet and practicing mindfulness, small changes can make a big difference. Your mental and physical health are interconnected, so taking care of both is key to living well with diabetes. If you found this guide helpful, please like, share, and subscribe to our channel for more health and wellness tips. Together, we can build a healthier, less stressful life. Thank you for watching, and take care.